Ontario Premier Doug Ford is destroying healthcare services for people who use illicit drugs. Ford has cut funding for supervised drug consumption sites, needle exchange, and distribution of harm reduction supplies. The government's reasoning? Providing people a safe place to use illicit drugs is the same thing as encouraging that drug use.
We need to offer people pathways out of addiction. We do not need to enable it, Speaker.
That's right. I'm passionate. We're going to help these people, but I'm not handing out needles and all the drug paraphernalia. Not happening here in Ontario.
This argument frames the use of illicit drugs as a moral issue rather than a health one. And once we start judging people's behavior, it's easier to ignore their experiences, their testimonies, and the overwhelming consensus of healthcare professionals. What will a future Ontario look like if Doug Ford gets his way and takes the province back to a time before harm reduction? In the late 1980s, Ontario was grappling with a different public health crisis, the HIV/AIDS epidemic. During these years, a person living with AIDS had a life expectancy of only 9 months. Queer activists and frontline service providers were demanding action from governments, but also making their own interventions. Safer sex education, condom distribution, and needle exchange became life-saving practices that started without government funding or approval. Without these interventions, many of which were illegal at the time, many more lives would have been lost. This was the beginning of harm reduction in Ontario. Harm reduction is an approach that accepts that people are going to engage in behaviors that carry risks. Instead of pretending that we can scold or police our way out of these behaviors, harm reduction seeks to educate people about the risks and minimize negative outcomes. Toronto opened its first official needle exchange in 1989. In the decades that followed, public health agencies expanded, and all the evidence showed that these practices were saving lives. Unfortunately, yet another public health crisis was brewing across Canada during this time: the availability of powerful painkillers called opioids.
Ontario wants the federal government to reconsider its decision to allow the generic version of OxyContin.
Doctors were overprescribing opioids, and their patients were developing addictions. While pharmaceutical companies were raking in the cash, the people who depended on the drugs were getting sick, overdosing, and dying. And a toxic supply of illicit drugs was flooding the streets to serve people who couldn't get their substances legally. In 2017, frontline workers who were frustrated with the government's inaction on opioid deaths decided to make a radical intervention.
A group of activists have now come together to open up a pop-up overdose prevention site here in Parkdale.
And people are using outside, they're using in public washrooms, they're overdosing in their homes and outside, and they're dying. The fear is that more people will die and that we have an ethical obligation to save people's lives.
Just like condom distribution and needle exchange, supervised consumption sites started in the community as a life-saving necessity. The model was adopted by governments and replicated across Ontario.
Harm reduction means meeting people where they're at, whether they're ready to get sober or not. We are here to keep them alive and keep them safe.
They actually helped me on my recovery to getting clean and getting help.
It's a safe haven for a lot of people. I'd probably be dead. I probably would have overdosed somewhere, who knows where, without being here.
The Ford government's decision to defund these sites and the needle exchanges operating within them is a death sentence for some people. Since Ford began his attacks on supervised consumption sites in late 2024, overdose rates have exploded.
Over this 8-day stretch in December, Toronto saw a spike in opioid overdoses. Paramedics responded to 122 suspected cases, 35% higher than during the same period in the previous 2 years.
Without safe places to use illicit drugs, people will use in public parks and laneways, in washrooms, and on transit systems. The risks of HIV and hepatitis C transmission and of fatal overdoses will increase. Instead of seeking care in safe environments, people will end up in our emergency rooms. The government's alternative to the sites are community hubs it says will address homelessness, provide treatment, and support addiction recovery. While these hubs may help some people, they are not a substitute for the immediate healthcare needs of people who use illicit drugs. Those people and the frontline workers at the sites have been crystal clear about the value of supervised consumption spaces. The Ford government is making a choice to take away healthcare from those who may not survive without it.